I'm Donna Smith, and I've been working in HIV research and community-based intervention since 2002, since 2007 at Georgia State University in the School of Public Health. We wrote a grant and we're funded through the Elton John AIDS Foundation to create a training program that was specific in training peers who are HIV positive to provide support and linkage to people who needed it most. The logic behind the peer guide movement is that people who come from communities that are similar to those in need of health support are more likely to be able to establish rapport with them and make those connections. The second year, we focused our recruitment on young Black gay men and transgender women of color because in Atlanta at this point in time, those are the two populations that are hardest hit by HIV.
When I first heard about the opportunity to be a part of this program, I really just could see the bigger picture of where this could lead when it comes to my personal future and the future of the community in which I serve. Serving the people in the Joseph E. Boone community has been such a joy. It just feels like family, it feels like home. It's a pretty rough area, but at the same time, I've met so many gems in this community. So many people who have educated me as well as me educating them. I think it's important to spread the awareness and the prevention messages that's going to empower people, particularly for the young Black gay community. Being able to guide people through the process, whether they're newly infected or they're trying to be adherent to their health. You have to show compassion and you have to be able to meet people where they are. And that's why I really wanted to be a part of this program. Has really contributed to my growth as a person and as a community activist.
When I first contracted HIV, I felt as if though it were a death sentence. I was maybe 90 pounds, about 6'1½". I got really, really, really ill. I got involved in the HIV and AIDS field right after coming out of the hospital because I knew that there were more people out in the world that were like me. I just wanted my sisters to know that there was hope. It is a great program. It teaches you all the ins and outs of everything, and you have hands-on trainings, and you just learn so much.
Facilitating this peer guide training program has really been one of the most rewarding experiences of my teaching career, and I've taught in different settings for a long time. What's special about this, I think, is how seriously the students approach this work. They know that what they're learning are really skills that can mean the difference between life and death. I see great potential for this program to have a major impact on the face of HIV/AIDS in Atlanta. The more peers that we can train and get positioned to work in AIDS service organizations, community-based organizations, and Ryan White health clinics, the more we're going to be able to increase the linkage rate, keep people in care, get them into care.